Good morning. We are here at the United Way of Cascade County's office. It's a beautiful building here. We're with Abigail Hill and Lacey Hallett once again, and they're going to start by talking about healthy lives and vibrant futures. My partner in the agency, Janet Duffy, she's going to lead us away and kind of ask some questions about the 4 pillars of the program.
Thanks, Todd. Healthy lives and
vibrant
futures. I kind of remember all these.
I don't know either.
Right? So, and that kind of explains United Way in general.
Right.
A lot going on and keeping it sorted. That's what you do. And moving forward. So we're really excited to be here and talking about the 4 major areas of focus that is under Healthy Lives, Vibrant Futures.
Yes.
So who wants to kick it off? Who wants to?
I can kick it off.
Okay.
Yeah.
Cool.
So Healthy Lives, Vibrant Futures, I think the important thing for the community to know is that this is a community voice driven initiative. And I say that because we derive this work from what's called the Community Health Needs Assessment. It's done approximately every 3 years. And this health needs assessment is actually a federal requirement for 3 of our hospital systems, Benefice, Indian Family Health, and Alluvian, as part of their federal funding systems, as well as part of our accreditation process with the City County Health Department, and Abigail is County Health Officer. So it's important to us to make sure that we put this out. The beauty of that assessment is that it is a perception assessment. So it goes out and it asks, instead of asking, are you diabetic, for example, it says, what are you concerned about in the community? I might be concerned about obesity. I might be concerned about substance use. And we pair that with real-time data. What are we seeing in the community? So a couple years ago, we did a huge push in some of our work around opioids and prescription drugs. And so we saw in the survey that rise. But what we know, even though that was risen as a concern, we know that like alcohol-related incidents and deaths is still the most prevalent substance use in our community. So we try and pair those things and back them side by side. But what it does is it allows us to look at where are the priorities in our community and what are people really wanting to see us make change. And that is what drives our 4 pillars. So the 4 of those are access to health care, prevention and maintenance, or excuse me, not prevention, maintenance of healthy weight. Yeah, prevention of obesity, maintenance of healthy weight, and that the healthy weight piece really speaks somewhat to chronic disease prevention, that long-term and quality of life, and then we have substance use reduction and responsible substance use, of course, and then prevention of child abuse, neglect.
Right.
Which is very much needed.
All very important initiatives.
So with those 4 pillars, we have some unfortunate circumstances here where we kind of rated very high in our county as far as on the child abuse and neglect. Do all of those just kind of in sync? Is the substance abuse a big driver?
One of those 4 categories is going to cover the neighborhood you live in, your access, your distance from a grocery store, all of that can fit into healthy weight. And there's overlap between a lot of them, so I think it's just what category you're using. So I think they are really all-encompassing of some of the health determinants that we see in a community, but it's just what issues are you picking within that umbrella. So when you have child abuse and neglect, that actually stemmed off of child abuse, and so substance use. So we used to have 3 pillars, and then they said, okay, we're really trying to cram a lot under substance use, including child abuse and neglect. And so it kind of came out, really we should probably give this more attention and have its own pillar. So there's crossover in all of them. So, one of the biggest reasons for child removal is substance use. And so there's overlap there. But then in access to health care, there's mental health, which plays a role into substance
rolls
use,
right
plays a
in.
role into child abuse, neglect, and access to care. There's also a lot with access to food, nutrition, right? So there's that piece. So there's a lot of overlap, and that's, I think, what's great. And the opportunity with these 4 pillars is to have more of that cross collaboration amongst the pillars too. And so that's why we have the steering committee, where we have leads of all of those groups that come together on a quarterly basis to kind of share what's going on in each group, talk about some of those collaborative opportunities as well. So I don't know if that answers
No,
your
that's
question there, but
exactly what I was
There's a lot
gonna-
of, it really is just how are you framing it? And I think the challenge is in each of those categories, you could pick so many goals,
Right.
so many objectives, and I think that's what the community helps dictate. What are those 4 pillars through our community
Right.
health assessment, and then those steering committees really look at, okay, what are our strengths as a community? What can we try to achieve? Because these are heavy. Like, it's really
Right.
hard to move the needle.
Right.
And, oh yeah, we're just going to improve the weight of our community. We're just going to get rid of child abuse and neglect. It's very challenging, but that doesn't mean you can't have hope and motivation to try to improve these
Improve them.
practices. But that's how the groups get together, and so we decide, okay, what are our goals for the next 3 years? What can we accomplish, as a community? And so those are a lot more narrow in focus, because you can't address every single element that's going to, influence healthy weight,
Right.
substance use. And so we really try to, as a group, as a committee, decide what we're going to try to tackle in the next 3 years.
I was just excited to hear about that 4th pillar. I thought that was important.
Yeah.
Well, and this is really a high level. Like, we're not delving into
right.
what each pillar is working
Right,
on.
we certainly could, but it would
and
take
we
a whole nother episode, right?
Well, we're 7. We may come back to do that. I mean, I would hope. What's the one thing? So the community needs assessment sounds like that's a priority.
Yeah, so when that assessment comes out, it is so important that people jump on board of sharing their voice. I've said this in previous episodes, we are about, United Way's role is really about community voice and then community partnership. And so if we're not hearing from people, it's not working.
When is the next assessment?
So the next assessment will be in 2024.
So this next
So it's
year.
coming, yep, it's coming up, and then we'll be looking for that community voice.
Okay.
And I think the other big ask that we would make to the community is when we give you the opportunity to hear those results and give us feedback, which we do a symposium with that every year. We talk about the work of the 4 pillars, kind of give a
Right.
highlight of some wins within those, that people show up for that.
Participate.
We end up
Yeah.
preaching to the choir a lot, right?
Yeah, the people that are in the trenches doing
Right.
the work are the
That are
ones
involved,
that show up
yeah.
to hear
Right.
what they're doing, but they know what they're doing.
Right.
So,
And
yeah.
I think bottom line is if people are passionate about any one of those 4 areas, those working committees are invested in engaging all partners. And so if you're passionate and you want to get involved in one of those, come to the table. They're begging
how
for
do
that.
they do that?
Yes, come to the table. So they can reach right out to me. United Way plays the convener role at the steering level. So we'll get them plugged in with the committee chairs and get them
Awesome.
handed off, and we'll make it a smooth transition for them.
And your
Awesome.
phone number again?
My phone number is 406-727-3400, extension 300.
And Abigail? Your?
Yeah, 406-791-9261.
Awesome. So lots of work to do.
So much work to do.
So much work to do. Thank you
Yes.
for taking the time to visit with us.
Of
for
course.
a few minutes
Yeah,
this morning.
Please live united.